If you ever went to your primary care physician and he said that you need to see the urologist, a lot of times it's because they found blood in the urine. Now you might be thinking, this is unfair, why do I have to go see the urologist because I've never seen blood in the urine, in my urine. Well, that's because there's two types of hematuria. The first one is you can see when we call it gross hematuria, and it's usually above 50 red blood cells per high power field. And microscopic hematuria is less than that, so your eye wouldn't be able to see it. So the reason why this is important is because hematuria or blood in the urine is really not normal. No one should have it, certainly not consistently. And a lot of times it's actually our only way of knowing that there's something wrong on the inside. So most of the time there's nothing bad happening, but there's enough times where there is something bad that we do need to complete a full workup. So what is a full workup? Well, a full workup just means that we need to figure out that there's nothing abnormal along the urinary tract where blood could be coming from. So that includes the kidneys, the ureters, the bladder, the urethra. Most commonly, hematuria is from urinary tract infection in women and from the prostate in men. But we need to make sure that the kidneys are fine because kidney cancer presents with hematuria, and a lot of times that's the only way that we know that it's there. Same thing for the ureters. Kidney stones also give hematuria. Kidney stones, 9 times out of 10 will give hematuria. So a lot of times if someone does not have any blood in the urine at all, most likely they don't have a kidney stone. And also bladder cancer, and that's a very high prevalence in anybody that ever smoked. So if you smoke and you have blood in the urine, for sure we need to take a look inside your bladder, because there's no other imaging modality that would allow us to actually see if you have bladder cancer. And a lot of times bladder cancer is really something that is manageable. So you can have a small little bladder tumor and we can resect it. But if we don't look and we don't find it and we can't, you can't scrape it off, then it might progress. So it's important to know when it's there. The full hematuria workup includes the CT scan, which allows us to look at the kidneys and the ureters, and the cystoscopy. Cystoscopy meaning, scopy means to look inside, and cysto means like bladder. So look inside the bladder with a camera. Now, a lot of times I do get patients coming into the clinic and they've had an ultrasound or a CT scan, but it's the wrong kind. What does that mean? It's because the CT scans that we need in order to completely exclude any abnormalities in the kidneys is a CT scan with contrast. The reason being that contrast goes wherever the blood goes. So if there's a lesion on the CT scan and we need to know if that lesion is actually taking up blood or not taking up blood, when we give contrast, it'll go there. If we do CT scan without contrast, it'll show us kidney stones, which could be the cause of blood in the urine. But it doesn't show whether or not some other lesions in the kidney are taking up contrast or not. So anything that looks funky that's taking up contrast is by definition, or until proven otherwise, kidney cancer. And that's why contrast is important. Same thing for the ureters. If there's a lesion in the ureter, it might be nothing. It could be a scar or it could be a tumor. And the only way of knowing is if it's taking contrast, because cancer is metabolically active, therefore uses oxygen, uses blood. And if it's not looking like normal anatomy and it's taking up contrast or taking up blood, that means it's cancer, or it's highly suspicious for cancer anyways. And that sometimes we have to do further workup, but then we know that we need to really further investigate. Bladder CT scan with contrast is not actually that helpful because the bladder is such a pliable and it's like an organ that changes shape all the time, and when it's decompressed, it's all folded in small little folds, so we can't really tell if there's something there or not. So that's why we need to look inside, because sometimes the lesion could be barely visible on a very, very velvety lesion, or it could be something very fine that's not looking like normal bladder, and the CT scan is incapable of. Now if we have a lesion in the bladder that's completely huge, then the CT scan will pick it up, but the negative CT scan is not enough to tell us that there's a normal bladder. And also the prostate can be bleeding. Now, prostate cancer is not diagnosed by cystoscopy, but in men a large prostate can bleed, and that's often the reason why they have hematuria. And same thing for urethral cancer. So looking throughout the whole entire urinary tract is important. and that includes a CT scan.